Hi there, I'm Kim Warren. I'm the nurse that's going to be helping out Dr. Smith today. Just gathering some information on what's currently going on and doing a bit of assessment, and then he'll come in and talk to you about the current complaint. So tell me your name
Tara.
and what's currently going on, what's happening.
For about a year now, I've been having some painful periods, and they last for longer than the usual.
They last longer, and what are they? Sometimes far apart, close together.
Both.
So there's no predictability to the pattern. All right. You're not on any medicine right now?
No.
And do you have any allergies?
Penicillin.
Just penicillin, okay. And nothing else currently going on? You don't have any injuries,
No.
no pain anywhere? Vaccinations current?
Yep.
Does your family have any history of major illnesses like cancer, heart disease?
Yeah.
Both parents or grandparents?
Yeah, on both sides.
Okay. Both sides have, like,
cancer, diseases, high blood pressure.
so both parents have a high blood pressure? And they're being treated for it?
Yep.
And I know you're 18, but do you currently partake in any kind of social things like smoking, drinking,
No.
unprotected sex?
No.
Okay, so we're just mainly here to talk about irregular periods, and we'll just get going with the assessment.
Okay.
How much are you weighing, do you know?
155.
Okay, so let's just start with some vital signs.
Okay.
I'm going to take your temperature with this temporal thermometer. Doesn't have to touch you at all. .98.4, that's definitely within normal range. I'm going to put this on your fingers. It's going to check your pulse rate, but I'm also going to listen with my stethoscope as I count with my watch. Over your heart. Also gives your oxygen reading, how well your blood is oxygenating the rest of your body. Good strong heart sounds. And you're 99 saturated with a heart rate of 70. Check your blood pressure. You don't have any kind of devices like a shunt?
No.
And Velcro. There we go. Sorry about that. It's 128/80, and probably because I pumped you up a couple times to get it right, it's reading a bit higher, but typically you'd wait 15 minutes and retake that. to get a better reading since I overpumped your arm. But we can do that maybe later on. So let me see your skin and hands and check your capillary refill. Pulses equal on both sides. No lesions on your skin. You don't have any cuts, bruises, anything going on right now.
Nope.
And I'm gonna check your turgor, see how well you're hydrated. Looks good. So next we'll go to just a general check of your head. So like checking your head for any bumps. You don't have any pain in the mastoid bones,
Mm-mm.
frontal sinuses.
Mm-mm.
Got these sinuses here.
Mm-mm.
Maxillary and frontal. Okay, I'm going to check your temporomandibular joint. Can you lower your jaw? No clicking. Does that hurt? Okay. And you don't have any hair loss?
Nope.
Okay. With the cranial nerves, they're going to check how well innervated your expressions are and different sensations, and we'll be using some different things here to check all of those things. The first thing is just smile and frown. Can you close your eyes and open? And then I'm going to, you close your eyes really, really tight. And I'm going to try to lift up and you stop me. Okay. So next we will check for sensation. If you can tell the difference between sharp and dull. So close your eyes and I'm just going to touch your cheek with an object and you tell me whether you know what the sensation.
Sharp. Soft.
Right, and then, okay, so just look straight forward. I want you to follow this object where I take it, just with your eyes, not moving your head. Okay, and then the next thing I want you to do is a spatial test where I want you to touch your nose and then touch this, and wherever I do it, you touch alternatingly from your nose to the pin light. So touch your nose, and now touch the pin light over here, and touch your nose. All right. And then, well, with the pin light, we will check your pupillary responses. So,
I'm gonna take my glasses off.
yeah, please. And I'm going to cover this eye, but leave this eye open and looking at me so I can see that it contracts when I bring it in. And the same thing with this eye. Look at me. Very good. You don't have any, I see you have glasses there for distance, or do you have close-up problems also?
Distant problems.
Only distance, okay. And I just want to check your conjunctiva.
Okay. Sorry.
And you don't have any like allergy eyes, anything like that?
Nope.
If I had an otoscope, I would look in your nose and your ears, but you don't have any like drippy nose.
Nope.
Septum looks good. I'm gonna look in your ears. You don't have any wax buildup, anything like that, hearing loss. No tenderness in your ears.
Nope.
Okay, and then I'm going to check your cranial nerve number 8, which is just, I'm going to whisper next to each ear and you tell me what I say.
Okay. Hi. Bye.
You don't have any sore gums, tenderness,
Nope.
bleeding of gums when you brush your teeth?
Nope.
Okay. And looks like you had braces, your teeth are pretty straight.
Yep.
Palate looked good, tonsils were fine, uvula was in the center. And we stick out your tongue. And do you have the ability to do the roll of the tongue? And we'll just check your, shuffle my papers around. No tenderness in the neck?
Nope.
Listen to your carotids. And good. And check behind you and check your thyroid. No tenderness in that area?
Nope.
Okay. Other spatial things that we need to check is just some simple range of motion. Can you put your arms up? And then up like this, out to your sides, and down all the way to your hips. So let's have you do this. And don't let me push them down. And then opposite, don't let me lift them up. And we would check that at the shoulders and the wrists. Both of those push up, push down resistance bilaterally. Okay, I'm going to give you a taste of something and you tell me whether it's sour or sweet.
Okay. Sweet.
That is sugar. I'm going to have you smell a spice and you tell me if you can identify it.
Cinnamon.
Correct. The other thing I was supposed to check with your ears is bone conduction. So if I had a real tuning fork, we would tap it on the table and touch it on your mastoid bones, and you would tell me if you felt it or heard it first. And then we would check the other side, and bone conduction is faster than air, so you would have that sensation first. So we check the thyroid, and we're going to move over here to the chairs so that I can check your chest and stomach.
Okay.
Actually, I'm going to need a tissue just real quick. All right. So, just checking your rib cage. You don't have any tenderness in this area.
Nope.
Not over your liver or your spleen.
Mm-mm.
And lower belly. Nothing's
Nope.
tender down here. I'm just gonna quick check your pulses right here. I'm gonna take a listen to your belly. When I have you sit back up, I'll listen to your lung fields then. And we'll start in the lower right, listening for gurgling sounds for at least 5 minutes. We go to the right upper, left upper, listening 5 minutes, left lower. All vowel sounds are normal. And we'll just tap and check for sounds over the spleen area and the liver area. Also check in the right midclavicular line for your liver borders. And we're tapping up, listening for a change in the sound and marking, and then tapping up, listening for that change in sound and measuring. It should be between 6 and 12 centimeters, which indicates no liver inflammation. Okay, so go on ahead and sit up and I'll listen to your chest. precordial sounds over your heart. All right, and deep breaths. We'll place the stethoscope over the scapulas because you can't really hear properly. You're listening to both sides, anteriorly, posteriorly. Everything sounds good. And next I'm going to put my hands on your chest. I'm going to check for tactile phrenitis, which I'm going to have you repeat the number 99 over, just, and say it in deeply as in your throat, not like high in your head, like 99, but say 99.
Okay. 99, 99, 99.
We're just feeling for equal vibration when you say that.
Okay.
Your skin, you have good skin color, you have good breath sounds, your heart sounds were fine, apical pulse is regular and rhythmic, not a tone sounds good. We did muscle strength of the upper body, so make some bicep muscles and don't let me push them down. Okay, and then I'm going to push up, so don't let me. All right. Check the, oh, okay, let me see your lower legs, and we'll check the pulses back here, both sides. And put your legs out, and don't let me push them down. And we do this again at the ankles and the knees, checking for strength and resistance both directions. Check the pulses, and so we're going to do the same test with the sharp dull on your shins. So close your eyes.
Dull. Sharp.
That is correct. We're going to check your reflexes. So we're going to have to do the one over your inner cube and your elbow reflex. Same side. If I had a reflex hammer, you'd see more reaction. And the patellar, which your legs would need to be dangling, and then I would tap and you would see your leg swing out both sides. And you hold up your foot. I'm going to check the reflex on the bottom of your foot. It's a sign that you would have a flexion of the foot, which would be normal. Okay, we're going to check like full balance. So I need you to stand up and bend at the knees and hold your arms out. And close your eyes and stand on one foot. Okay. And then just walk over there out of camera and walk back in camera. Have an even gait. And then do tiptoes, same thing. And back. Okay, so everything checks out really well. All your sensations are good. You have good balance. Nothing's going on except you're in that age range where irregularity is normal. So we'll talk to the doctor. He may put you on a pill, which you'd need to follow up and check back and see if it's actually working. You may need to find the one that's right for you.
Mm-hmm.
And thank you, and I'll send him in.
Thank